We have 12 new cases who have tested positive in BC here today, bringing our total to 2,479 people who have tested positive for COVID-19 in BC. That includes 887 people in the Vancouver Coastal Health Region, 1,223 people in the Fraser Health Region, 126 people in the Vancouver Island Health Region, 183 people in the Interior Health Region, and 60 people in the Northern Health Region. We continue to have active outbreaks in long-term care and acute care in our health system. We are now down to 17, with 14 in long-term care or assisted living and 3 in acute care. There are no new outbreaks to report, and 1 in the Windermere Care Centre has now been declared over. Of those outbreaks, we now have 537 people who have been affected, including 329 residents and 208 staff. In terms of community outbreaks, we do have one additional outbreak where we have a single case, and that's in the Matsqui Federal Correctional Institution, and we are working very closely with our federal correctional colleagues and Fraser Health Authority to ensure that we are doing everything to prevent any additional cases in that facility. This person was identified early and has very few risky contacts, so that's a good thing for us. And also in a positive way, the United Poultry outbreak, which was one of the first poultry facilities where we had 36 staff who were affected, has now been declared over, and that facility, as we know, is up and running again. We have now 307 active cases here in British Columbia, and of those, 43 people are in hospital, and 8 of those are in critical care or ICU. We have an additional 3 people who have died from COVID-19 in BC today, bringing the total number of people in our province who have died from COVID-19 to 152. That includes 1 person in Vancouver Coastal and 2 in long-term care and Fraser Health. And our condolences go to the families and the care providers and the communities that love these people. We now have 2,020 people who have fully recovered from COVID-19. I just wanted to report on a few additional things. We've now screened over 40,000 travelers who've come into British Columbia either from air or by land, and ensured that they had a valid isolation plan. As you know, we continue to have restrictions and require 14 days of self-isolation for people who come into British Columbia from outside of the country, and we have in addition provided over 120 people, 125 people with accommodations so that they can fulfill their self-isolation. And I'm heartened to hear that very similar measures are now being taken by Alberta, and we feel that these are important measures to protect our borders and protect all the work that we've done in the province ongoing, and we're looking to ensure that those types of measures will continue as we move through this phase of our pandemic and into the future. I also want to give you an update on some of the, there's been some media around reporting on deaths and the number of men and women who have died in the country and in the province, and we provided an update in our epidemiologic update about 2.5 weeks ago. But it's interesting that some of the reports from across the country indicate that in particularly in Ontario and Quebec, where they've had the most deaths from COVID-19, that there's a majority of women who have died, and that is not the case that we've seen here in British Columbia. And just to update you, of the total number of cases that we have, 52% or 1,290 have been in women and 48% in men. But when we look at the number of people who've been hospitalized or in ICU, that reverses. So we have more men, about 60% of men have been hospitalized, and 64% of the people who have ended up in our intensive care unit or needed critical care have been men. In addition, when we come to the people in BC who have died from COVID-19, 95 or 62% have been male, versus 38% or 57 of whom were female. So our stats are slightly different from what we're seeing in other provinces across Canada, and are in keeping with what we have been seeing internationally as well, where there seems to be a differential, more severe effect on men than women. And again, we're not entirely sure what the rationale is for that, and there's a lot of studies that are being going on around the world to try and understand the immunology better. Another thing that has come out in the media in the last little while is about our advice around the additional precaution that can be layered on to what we know works to prevent the transmission of COVID-19, and that includes the use of a non-medical mask in certain situations. So as we know, the things that we continue to need to do to prevent transmission of this virus are to stay home and away from others if we're sick ourselves, to keep that safe distance, and all of our restart plans are really focused around making sure that we can reduce the number of people that are in a place, making sure that we have physical barriers in place, making sure that we can keep our safe distance from others to prevent transmission. Obviously, washing our hands regularly and covering our cough are really important, and cleaning and disinfecting common surfaces. But an additional layer in some situations that can prevent you from letting your droplets out includes the wearing of a cloth or non-medical mask. And it can play an important role in some of those situations, particularly in enclosed or crowded settings where you might be indoors. And some of the settings where it might be a really important additional layer is on settings like public transit, where you may not be able to always maintain that distance, or in small retail stores, for example, where barriers or other measures that are more effective may not be always in place. So for us, I've talked about this before, it is an additional layer that is appropriate in some settings, and it's really a way of protecting others from our own droplets and keeping our own droplets from going into surfaces around us. And really it's a measure of being polite and respect for others. And in that sense, it certainly is something that people can consider, and we would recommend in certain situations for those small periods of time where you may not be able to control your distance. Other situations, of course, that it is going to be helpful are in situations where you need to be within somebody's safe space for a period of time, and we're thinking of things like physiotherapy or massage or hairstylists, where if both of you are wearing a mask, it keeps both of you from spreading your droplets to each other. The other thing, of course, that has been on a lot of people's minds in the last few days is about our plans to reopen in-classroom schooling for some children come June. This is an approach that's been taken with considerable thought and cautiousness, and I have confidence in the approach that we have developed for June. Schools will have strict protocols, enhanced infection and prevention. Workplace health and safety has been involved in ensuring that we have the right measures in place. And again, it fits into all of the other things that we are doing to live with this virus in a way that keeps people as safe as absolutely possible. And that will include much smaller numbers, keeping physical distance within classrooms, making sure that we have processes in place to exclude anybody who feels unwell. And I know people have been concerned about some of the language around that and how will we know. And certainly if anybody in a family has an illness that could be COVID-19, then we are saying be cautious and keep the other family members home as well. But to make sure that you have it checked out, that you call your family doctor, call 811. We also know that anybody who has tested positive for COVID, that their close contacts will be contacted by public health, and they will stay away and stay home for the period of the incubation period after their exposure. So these are the things that we have in place. And we know that this is going to be a challenging time for some people, and it's going to be nerve-wracking for all of us as we get used to having these provisions in place and knowing what to do. But we do have, like all illnesses that can be transmitted in close contact in a school setting, we do have a notification process. We have processes in place to ensure we know what to do and that we can safely separate somebody who's feeling unwell, and public health will be there to support you to make sure that we have what we need in place in our school settings. Finally, the province-wide Your Story, Our Future survey continues to be available for people. We've had over 290,000 British Columbians so far who have completed the survey, and I would encourage everybody to, if you've done it yourself, to pass it around to friends, to help others access it as well. So as we've said, we are in this second phase. We need to be slow and thoughtful as we move through this. We need to watch carefully, and that is what we are doing in public health over the coming days and weeks. And we are here to work with you, whether it's through WorkSafe BC, your local environmental health office and public health officers. We'll work out the kinks over the coming weeks as we gradually open up to that place where we can sustain it for a period of time. We are watching closely, and we all need to continue to commit to those important measures so that we don't lose all the gains that we've had in the last few months and all the work and the sacrifices that we've made across the province. We need to continue to do all we can to protect our families and our communities across the province. And we do that by supporting each other and working together on this and continuing to be kind and to be calm and to be safe.
I wanted to join Dr. Henry in expressing condolences to the families, the friends, the caregivers of the 3 people who passed away, 2 of them in Fraser Health and 1 in Vancouver Coastal Health in the last 24 hours from COVID-19. It is, I think, always worthy of reflection, of lives lived, of people that are lost but who have lived extraordinary lives, in all 3 cases, long lives, and who've passed away. And we know, regardless of the circumstances, that is difficult, and in these circumstances is extremely difficult. And we want all of you to know that we are, especially the families, but all those including the communities involved, that we hear your sorrow and we stand with you. I wanted to note on that point that 2 of these cases were from long-term care, and that we are continuing the policies, the severe restrictions that have been put in place on visitors in long-term care and acute care. And I know personally, and I think we all know, how significant and how serious and how difficult that process is. We continue to have 14 outbreaks in long-term care. We've seen in the growth of cases, for example, at the Langley Lodge, even in recent weeks, that this continues to be a significant issue for us. British Columbia has done significantly better than other jurisdictions, but that doesn't change the fact that a lot of people have lost their lives, and the situation in long-term care remains serious, and the measures that have been put in place by medical health officers across British Columbia to protect residents in long-term care must continue to be in place. And I'm going to report on one of those initiatives, the single site initiative, shortly. I note that there are 43 people currently hospitalized in BC. That's 21 in Fraser Health, 19 in Vancouver Coastal Health, and 1 in each of the 3 other health authorities. That increasingly our hospitals are slowly becoming more occupied. So about 69% of beds are occupied across the system at the moment, and 53% of critical care beds are occupied at present. Yesterday we had 5,101 emergency room visits in BC, which shows we're continuing to see that new level of people appropriately using the healthcare system. This is happening at different rates in different health authorities. For example, we're much closer to 100% in ERs of pre-COVID levels on Vancouver Island than anywhere else. But nonetheless, people are doing that, and our healthcare system for all non-COVID procedures is becoming busier. I wanted to provide a 4th update to you On the single site proposal, this is a proposal or the policy. This is the policy that employees in long-term care, assisted living, private hospitals, standalone extended care hospitals, and provincial mental health facilities are restricted to working at a single site. We started with 545 facilities, hosting multiple facilities employees, with a total of 7,350 employees who worked at multiple sites. Here's where we are right now. Of those 545 facilities, 499 have completed their single site plan. That's an increase of 4 sites from last week. Others are in process, but again, we are not reporting in process plans, just completed ones. That's 121 in interior health. That's a correction from last week when it was 122. It's 121 in interior health, 141 in Fraser Health, including 2 provincial health services sites, 96 in Vancouver Coastal Health, including 6 Providence healthcare sites, 106 in Island Health, and 35 in Northern Health. The number of site plans announced today are the ones that are completed, and but others, and the others, the ones taking us to 545, are in the process of being completed. As I mentioned last week, the ministry continues to work with health authorities to gather detailed information from non-Health Employer Association of BC sites on current compensation. This has been a complex task, as health authorities and the ministry have not had insight into the actual wage and benefit costs at many private and not-for-profit locations. The ministry has worked with legal services, health authorities, and industry partners to develop a provincial template and process, a webinar to support implementing this plan for Tuesday, May 26, 2020. Once the information is received, the ministry will be analyzing that information with health authorities to ensure that all the appropriate funding flows from contractors and employers to frontline staff. Again, funding is expected to flow in early to mid-June and will be retroactive. With regard to overall cost per month, as I noted last month, we'll provide detailed information on all of the contracts once this process has been completed. The move to single site is complex, but it is necessary, a shift in our approach to care. And I want to thank everybody, from unions to providers to those managing the care sector, for their cooperation in this effort. We'll continue to update you every Thursday so that people are aware of our progress in this regard. I wanted to also bring you up to date on progress with respect to surgeries. As you'll be aware, on March 16th, we delayed all non-urgent elective surgeries, and our estimate of the total number of surgeries that represented was approximately 30,000 for that 2-month period. Of course, we continue to provide urgent scheduled surgeries and emergency or emergent surgeries in that time. So from the period from March 16th to May 17th, we completed 20,000, or the system completed, and doctors and nurses and healthcare workers completed 23,385 surgeries. That's 4,015 in interior health, 7,121 in Fraser Health, 4,879 in Vancouver Coastal Health, 4,720 in Vancouver Island Health, 1,365 in Northern Health, and 1,285 in the Provincial Health Services Authority. Of those 23,000, 12,369 were scheduled and 11,016 were unscheduled or emergency surgeries. This is, I think, given the challenges facing the healthcare system in this time, an extraordinary achievement by our healthcare workers, and we are grateful for it. As you all know, on May 7th, we announced our new surgical plan to try and respond to relaunch elective or scheduled surgeries in BC. From May 7th to May 17th, we contacted 12,016 patients in BC as part of that plan. And this week, the surgeries booked this week, the scheduled surgeries booked this week, amount to 2,586 in the first week. So the first scheduled surgeries on May 18th to those that are scheduled through May the 24th. Again, we're getting started. It's a very challenging process, but what this indicates is the commitment of our surgeons, of our nurses, of our healthcare workers to providing the same energy in addressing people waiting for surgeries as we've provided in our response to COVID-19. Last week, I provided 2 such updates on surgery and our surgery renewal commitment. 2 days ago, I was able to announce that postponed surgeries had resumed in 49 sites across 5 regional health authorities and the Provincial Health Services Authority. And today we added this detailed information on our progress. That word, progress, is an important word in delivering on surgery renewal. Important because as much as surgery renewal depends on those in the operating room, it also depends on all of us. It depends on our ongoing commitment to use the skills we've learned from Dr. Henry and from public health officials to stop the spread. As Dr. Henry has made clear, a second wave of COVID-19 is very likely given the history of pandemics. And as we made clear in our surgery renewal commitment, we expect to complete all lost surgeries. But let's make no mistake about it. Surgery renewal is shaped by COVID-19. Our success will be dictated by future events, such as the resurgence of COVID-19 or the potential for a second wave. As we head into our first weekend of Phase 2, an exciting time because of the reduction of some restrictions and the increase in our contacts, we need to continue to be 100% all in our efforts to prevent a resurgence of COVID-19. We want to stay healthy to allow the progress we've been making on surgery renewal to build. For the weeks and months ahead, the only thing any of us wants to spread in BC, through our words and our actions, is the messaging that physical distancing matters. Physical distancing saves lives, it stops the spread, it flattens the curve, and it gets people the surgeries they need. Physical distancing saves lives. Spread the message, not the virus.